Hello everyone. I will be presenting a systematic review on the efficacy of instrument assisted soft tissue mobilization, which is commonly known as Iastm, in the treatment of acute ankle sprain and functional instability. Ankle sprains are the common musculoskeletal injury that, if not treated properly, can lead to long term complications such as chronic ankle instability. This presentation highlights the current research evidence supporting the role of IASTM in enhancing recovery and improving functional outcomes. This systematic review aims to evaluate the efficacy of instrument-assisted soft tissue mobilization in the management of acute ankle sprain and functional instability. Background: instrument-assisted soft tissue mobilization has emerged as a promising technique in musculoskeletal rehabilitation. Yet its efficacy in acute ankle sprain and functional instability remains unclear. This systematic review aims to evaluate the effectiveness of ISTM in improving pain, range of motion, and functional outcomes in individuals with acute ankle sprain. Methods: a systematic search of electronic databases will be conducted to identify randomized controlled trials and clinical studies published in peer-reviewed journals. Studies will be included if they examine individuals aged 18 to 45 years with grade 1 or 2 acute ankle sprain and utilize ISTM as a primary intervention. The methodological quality of included studies will be assessed using appropriate risk of bias tools. Results: the findings will summarize the effectiveness of IASTM in comparison to conventional rehabilitation methods, highlighting its impact on recovery, pain relief, and functional outcomes. Conclusion: this review will provide insights to the clinical utility of IASTM in managing acute ankle sprains and functional instability, potentially guiding physiotherapists in evidence-based practice. Future research directions and limitations will also be discussed. Now, let us move into the core of this presentation. Ankle sprains are among the most common musculoskeletal injuries in both clinical and athletic settings. They occur due to excessive inversion or eversion of the foot, leading to ligamentous damage, pain, swelling, and reduced range of motion. These injuries are particularly prevalent in sports such as basketball, soccer, volleyball, and running, where sudden directional changes or missteps increase the risk of ankle instability. Among the different types of ankle sprain, lateral ligament injuries account for approximately 85% of cases, with the anterior talofibular ligament being the most frequently affected one. This is due to its limited ability to resist inversion forces during plantar flexion, making it vulnerable to overstretching and tearing. The incidence of ankle sprains is high, with studies indicating that approximately 23% of individuals in the general population will experience an ankle sprain at least once in their lifetime. However, this percentage is significantly higher among athletes. Instrument assisted soft tissue mobilization is a manual therapy technique using specialized tools to apply mechanical pressure on soft tissues. It is designed to break down scar tissue, improve tissue mobility, and stimulate fibroblast activity, enhancing recovery outcomes. Here, the mechanical effects. The applied pressure facilitates the breakdown of dense, disorganized scar tissue and encourages proper fiber alignment in healing ligaments. It enhances joint mobility and soft tissue extensibility, helping to restore range of motion. Physiological effects. IASTM increases local blood flow and fibroblast activation, which are crucial for tissue regeneration. It stimulates mechanoreceptors, which improving proprioceptive feedback, which is often impaired after an ankle sprain. Rationale: ankle sprains involve soft tissue damage. Iastm may be beneficial in addressing tissue dysfunction and improving rehabilitation outcomes. Research gap. Most existing studies on Iastm focus on chronic conditions with limited research on its effects in acute ankle sprains. Objective. To assess the efficacy of Iastm in reducing pain, improving range of motion, and enhancing functional recovery. Inclusion criteria. Population. Individuals aged 18 to 45 years with grade 1 and 2 acute ankle sprain. Intervention. ISTM applied alone or with conventional physiotherapy. Comparison. Traditional treatments, exercise or no treatment. Outcomes. Pain reduction, range of motion improvement and functional recovery. Study selection and data extraction. Prisma flow diagram was used to illustrate study selection. Key extracted data included study design, sample size, intervention details, outcome measures, and adverse effects. This is the Prisma flow diagram, which illustrates the systematic process of article selection for this review. Initially, a total of 189 articles were identified. Based on the title and abstract review, several studies were excluded for not meeting the inclusion criteria. The remaining six full text articles were then assessed for eligibility. Finally, six studies were included in this systematic review. Quality assessment. The Petro scale was used to assess study quality based on randomization, blinding, follow up, and statistical reporting. The Petro score evaluates key aspects such as random allocation, blinding, baseline comparability, and statistical reporting. Each study is scored out of 10, with higher scores indicating better methodological quality. In this review, most of the included studies scored between 8 to 10, indicating moderate to high quality. These support the validity and reliability of evidence used to assess the effectiveness of ISTM in treating acute ankle sprain and functional instability. The forest plot illustrates the pooled effect size for the studies included in this review. The overall effect size was found to be 0.48 with 95% confidence interval ranging from 0.30 to 0.66. Since the confidence interval does not cross zero, the result is considered statistically significant and it suggests moderate benefits of IASTM in pain relief, range of motion, and functional improvement. Results. A total of 6 randomized controlled trials involving 320 participants. Sample sizes ranged from 30 to 75 participants, aged 18 to 45 years. Pain reduction. Significant decrease in pain with IASTM compared to controls. Range of motion. Improved ankle mobility post IASTM treatment. Functional outcomes. Enhanced balance, proprioception, and mobility scores. Swelling reduction. Some studies reported decreased edema with IASTM. Muscle activation. Improved neuromuscular control and strength. Short-term effectiveness. Benefits observed within 2 to 6 weeks, but long-term effects remain unclear. Discussion. Effectiveness of IASTM. Pain reduction. All studies reported significant pain relief. Range of motion improvement. IASTM consistently improved dorsiflexion and plantar flexion. Functional recovery. Faster return to activities in IASTM groups compared to traditional care. IASTM benefits. breakdown of scar tissue and facial adhesions, increased fibroblast activity and collagen synthesis, enhanced blood circulation and lymphatic drainage, neuromodulatory effects improving proprioception. Limitations and future research directions. Small sample sizes in included studies, variability in treatment protocols, that is, Iastm duration and pressure, lack of long term follow up studies on re injury prevention. Future trials should standardize Iastm application and evaluate long term effects. Clinical implications. Iastm should be considered as an adjunct therapy for acute ankle sprain rehabilitation. It helps address soft tissue dysfunction, enhances range of motion, and prevent chronic instability. Athletes and physically active individuals may benefit from faster return to sports. Conclusion. IASTM is effective in pain reduction, range of motion improvement, and functional recovery in acute ankle sprain. This systematic review examined the efficacy of instrument assisted soft tissue mobilization in the management of acute ankle sprain and functional instability. Based on the included studies, IASTM demonstrate potential benefits in reducing pain, improving range of motion, and enhancing functional recovery when incorporated into rehabilitation protocols. The findings suggest that IASTM may be an effective adjunct to conventional physiotherapy interventions in managing grade 1 and 2 acute ankle sprains in individuals aged 18 to 45 years. Thank you for your attention. I hope this presentation has been informative. I would like to express my sincere gratitude to my guide, Dr. S. Gerald Edwin Raj, for his valuable guidance.